Hi, my name's Cole. I'm going to be your student nurse today. Can you tell me what your name and date of birth is? All right, Betty Jones, 5/18/1996. That matches the order that I have here. All right, so Betty, today what we're going to be doing is inserting an intravenous catheter right into your vein. That way we can give you your medication. So right away, I'm going to assist the client with getting into a dependent position. Put down a chucks to protect the linen. And then I am going to want to say a few things. So one, if Betty was a child, I'd want to make sure that her parents with her. And if she was an older adult, I might just want to use a smaller gauge needle or a smaller needle size. Now we're going to get our supplies ready. Going to flush all the air out of my line. As you can see, it's bubbling at top. So that means that we aren't going to be putting any air bubbles into anyone today. All right, now I'm going to want to clean the site. All right, so Betty, can you tell me if you're allergic to alcohol prep pads or betadine or iodine? She verbalizes that she doesn't. I palpated and I found this really nice juicy vein right here. It isn't at the elbow or the wrist, so we are going to clean outwards in a motion. And I have my tourniquet right here. I'm going to want to make sure that it is 15 to 20 centimeters above the site. I am going to put on my gloves. Put on the tourniquet. I'm gonna make sure that it isn't on any longer for more than 2 minutes. I'm also going to ask Betty to clench her fist to promote vasodilation. Now we have our needle. I loosened it up earlier, just touching the pink hub. And I'm going to remove the alcohol prep pad. This is now dry. All right, I'm going to pull the skin taut. I'm going to insert at a 5 to 15 degree angle. And then as soon as I see that flash, I'm going to immediately go almost parallel to the body, advance it about an extra ½ centimeter, and then just slide the catheter in the rest of the way. All right, now I'm going to want to take my Tegaderm dressing and put this securely over the top. Remove this, it hasn't been any longer than 2 minutes. Now we're going to take our flush and screw it in. I'm still maintaining control of the hub and I haven't touched the site. Now I am going to flush her vein with 10 mils of sterile saline. I'm going to place tape right here to stabilize it. I argue we could have done that earlier, but I wanted to get that flush in with the way that her arm was bleeding. And then I'm going to tape a second time right down here. And then I am going to want to clamp this. And now I'm going to remove the flush and then also put down this piece of tape with the time and the dates. Then I would want to engage the safety on my needle and dispose of my supplies properly. Some things that I'd want to document are the date, the time, the route, the number of attempts, the size of the needle, the amount and type of solution used. And then I would want to check in with Betty. Hey, are you doing okay? Are you feeling all right? You're not going to pass out on me. That did bleed a little, but you handled it like a champ. Next, I'm going to make sure that she's safe and comfortable. Perform hand hygiene one more time. And leave the patient's room. Thank you.